Hello, dear aquarist. You selected this case number 262 about the Pangasius, the blue shark. Usually this fish is supplied from Thailand or Asia, where the fish have been pond raised. And in this case, we found a parasitic infection, Spironucleus. That might interest you when you see the videos of the parasites that are causing, well, damage to the fish. So I show you my findings, and I hope you like it to understand this kind of fish disease that we encounter with many different species in our hobby, in our aquarium industry. The Pangasius with the parasites Spironucleus. Spironucleus used to be called Hexamita. Details about Spironucleus, Hexamita in different fish, not only Pangasius, but also in cichlids, Malawi, Tanganyika, South American cichlids, in tetras, and many different fish. You can find details about that in my books on fish diseases that you can order in different languages. And the link is here below in the commentary or in the detailed section where I describe my video. Here is the Pangasius, who looked very slim and skinny, was wasting away. That's how it looked like. That's how a fish can look like with a parasitic infection. Which infection? Well, that's why we use a microscope. And here we could see, you see these tiny little things moving around at 100 magnification, 200 magnification. You can see them here. So we go higher to 400 magnification. You see these little bugs moving around in the intestine. Here is some excrements. And here is the lining, the gut lining. And that is damaged due to these parasites that's causing damage to the microbiome and are causing a risk of secondary bacterial infections. Here we see the same part of the gut with the parasites, Spironucleus at 400 magnification. And they're permanently moving around, they're permanently having an impact. You can see here that the lumen here, the wall of the intestine is getting thinner and might be becoming, well, uh, penetrated by the parasite, might be make little holes in it, or damage in it, and that make a risk of, well, a leaking gut. That's another name that can appear. Then the fish can get an overall systemic infection. So the treatment for this Pangasius, well, is that you realize we have to deal or to treat the parasite Spironucleus, and usually metronidazole, if you correctly dose it, stay on the correct dosage. I see a lot of people using excessive dosages, overdosing, thinking, well, I use the double amount, it will work much better, much faster. No, I discussed that in videos on errors that people make in our industry and their hobby. Use the correct dosage and the correct timing. For example, metronidazole, it's between 400 and 600 milligrams per 100 liters for 2 days only. More is working averse, is working not at all, can even damage the fish, can have an impact that the fish will not be cured, but even be getting worse. Ask in your aquarium shop, they should know. Be aware of secondary bacterial infections that can appear, so we have to check on that. But you can help the fish to survive better during that infection while you're using medication and preventing maybe bacterial infections would appear. Use a functional fish food like our Dr. Bassleer, buy fish food Lapacho. That helps this fish. Learn more about fish diseases in my books, available in different languages, and the link where you can buy them is below. Patreon is offering a service for you. You can select how to deal with fish diseases, how to deal with quarantine, how to learn to diagnose fish diseases. Go to my Patreon channel. So I hope this video helped you to understand this specific parasitic infection in Pangasius, but maybe also in other fish in your aquarium. Thank you for watching.